Hi everybody, it's Martha Kennedy, and today I wanted to talk to you about documentation. Have you ever heard the saying, nurses, that if it's not documented, it's not done? Well, this holds very true. What we need to remember about documentation is that it lets the next person, the doctor, and everyone else show what I've done that day. So today we're going to go over just a few things that are really important to document on, but know that this is not everything, but these are some of the highlights, okay? Let's talk about medication administration. Anytime you administer a medication, you need to go to PCC, to your MAR, and there's an area, you'll click on the medication, and it says, was it given, yes or no? You click yes, and you click save. It's very important, because remember, if you did not document it, they did not get it. Let's talk about something called sliding scale insulin. So it can be a little different. Sliding scale insulin is usually ordered for people that maybe their insulin goes high and low. They're trying to figure it out. It goes along with what's called a blood glucose. So you may have sliding scale insulin, 4 times a day, 2 times a day. And what you want to do there is you want to go and take the patient's blood glucose level. Once you get that result, you're going to look at the sliding scale and see if there is an order for that. For instance, I have a sliding scale of result of 215. Well, I look at my sliding scale and it says 200 to 250, give 5 units. So then I would give 5 units of whatever insulin's order. I would document it in PCC. Let's talk about something different. What if it's too high, and that's not on the sliding scale? It's 500, or it's too low, it's below 60. We should have parameters on each of them, and those should say for you to notify the MD. That's very important, because that means it's too low or too high, and we know that hypoglycemia can be bad, and we don't want anyone to go into DKA. That's really bad. So remember that. Very, very important. Let's talk about safety devices. Okay, now when those are put where you document them in the MAR, they're in the care plan, you want to make sure you go into that room. If it says low bed, if it says scoop mattress, some people call it concave, but the special mattress or specialty mattress, or if they have a fall mat, you want to make sure you look and that's there and you document on it. You want to document, yes, it is in place. And you're saying, I checked and it was there. I'm a prudent nurse. I got it all together. I know it's there. I know where it is. The resident's safe with the interventions that we have come up with to keep them free from injury, or as close as we can. Let's talk about behaviors. So many times I'll have residents that have behaviors and I'm seeing them, and then I'll go to the MAR and it'll say 0000. We have to make sure that we say what the behaviors are, how many times they had them, and anything we did as far as an intervention and side effects, okay? So I have a resident, they're yelling out. They always yell out. Well, we know that's not normal, right? So if it's something that you or I would not do daily, then it's not normal. There's an unmet need. So you need to document that on the behavior monitoring. And then the intervention that you did. You'll notice on there's a key, and it says, did you redirect the patient? Did you give them music? And you could fill in, hey, if I give this person a snack, then they're okay. They stop thinking about it, or they change around. What did you do besides just giving them medicine? Okay? Make sure you put that on there. And side effects. Are they having any of the side effects that come along with those medications? And they're listed. There'll be some drowsiness. This is very important. Drowsiness, lethargy. Is it doing something different to them, that medication? Are they starting to have a tic, tardive dyskinesia? All these things like that. Very important. So these are just some things on documentation. Remember, if it's not documented, it's not done, and that means you as a prudent nurse didn't do what you were supposed to that day. And I know you do, so please take credit for it. Thanks, guys. Bye-bye.